Hey, Dr. Shakif here from Irvine Spinal Wellness Center, your Irvine Chiropractic Posture and Movement Clinic. This video describes what radiating pain is, because there's a lot of misconception about that, and then how you go about fixing that. So stay tuned. All right, let's talk about radiating pain. Radiating pain can be due to nerves, not necessarily always. It can be due to soft tissue like your muscles or even your internal organs, but not always. Or it can be due to structures, soft tissue in general being pressured on, but again, not necessarily. So just because you have pain radiating does not mean one specific thing. That's why it's so important when you're talking to your doctor or chiropractor or physical therapist to explain what that really means. The nature of pain tells us quite a bit about the source, more than likely, not always. When I talk about nature of pain, I'm talking about, is it dull, is it achy, is it sharp, is it stabbing? All of those are what I'm referring to. You can actually have pain radiating to other parts from your internal organs. For instance, you can have gallbladder issue and come to me with right shoulder pain. But in reality, it's your gallbladder that shoots pain to your shoulder or even the back of your upper back area. You can have pain as a result of stress or irritation of a nerve at the site where it comes out of your spine or along the path of that nerve. So that's referred to actually as a radiculopathy. Radiculopathy is when we can trace, there is a really specific nerve pattern that we see, or the function of that specific nerve, we can see that being compromised. Of course, the way we see a function of a nerve is through movement. Like if a muscle is supposed to flex versus extend, that's a function of a specific nerve coming from my neck. However, if a person can't do this or it's not strong enough, it doesn't always have to be a nerve issue. So there is some crossing there too. Most of the times, that radiating pain is as a result of trigger points inside a group of muscles or along the path of progression of movement. So for instance, when I bring my arm up like this to about here, it's all shoulder joint. From here up, my shoulder stabilizers play a role. So seeing what movement, in what order, in what progression is compromised is a key. That just means that your doctor, whoever that is, needs to spend enough time to understand your story. When you come in, you're full of information about your problem. For us, we need to be smart enough to, number one, pay attention. Number two, put all the pieces together. And the worst thing we can do when it comes to movement is to say, oh, so the problem is from here to here. What muscles are involved from here to here? And I'm going to go address those. The issue here that gets missed a lot has a lot to do with the fact that over time of having issues in this range, a lot of other movements were compromised. A lot of other body parts had to come in to pick up the tab for whatever was not being done. The neurology of movement changed, and now fixing this is not the only part of the resolution. We have to go and put this in conjunction with movement of other parts and evaluate to see where there is less of a better performance, less optimal performance, and then fix that. Does that mean it's going to take forever? Absolutely not. Does that mean if you don't do it, you're going to die from it? No, but you're going to be miserable with a lot of other things showing up because the proper issues were not addressed. So anyway, going back to radiating pain, not every radiation, or when I say radiation, I'm not talking about like radiation for cancer. I'm talking about radiating pain here. Not every radiating pain is a nerve issue. So get that out of your head. Just make sure whoever you seek care from has a good connection in spending time to understand and explain to you. At the end of the day, you're the one that walks in with that problem, and you're the one that plays a huge role in solving that problem. You just need to be coached and guided better. If you have any questions, contact me through one of the methods of contact in the description box, and make sure you subscribe to my channel and visit my website to better understand about postural neurology and functional movement like dynamic neuromuscular stabilization, or DNS. Until next time, take care.